Hi, I'm Edward St John. I'm the chair of the iBra-Net Innovation Group, the consultant oncoplastic surgeon, a clinical entrepreneur fellow, and a co-founder of a digital health company. And I'm going to talk to you about the Innovation Group on behalf of iBra-Net.com. So innovation in healthcare is of increasing importance. For example, in England, the NHS England says innovation is critical to enabling NHS England to ramp up the pace and scale of change and to deliver better outcomes for patients. And an increasing number of surgical societies are starting to stress the importance of innovation, both in the UK and internationally. This nice flow diagram that I've taken from the paper listed below shows how important innovation has been in breast surgery over the years. And innovation really is the stepwise progression resulting in better outcomes for patients. Now, Peter McCulloch in 2013 modified the evaluation framework for medical drugs so that an evaluation framework could be made for medical devices, and this is what he came up with. And you can see that he's said that in stage 1 it's the conception of the idea through to stage 2A development, stage 2B exploration, stage 3 assessment, and stage 4 long-term study. And here at the iBra-Net Innovation Group, we really focus down on the first 2 stages in the idea and development stage. And as we show proof of principle first in man, we will then hand it over to the iBra-Net project stage for national evaluations. So here in the Innovation Group, our purpose is to strengthen relationship with industry, to aid transition into clinical trials and evaluations, to give support and advice for clinical innovators and entrepreneurs, and to liaise with subspecialty innovation groups. So I'm going to quickly show you our website, talk to you about our industry database, show you an example of an early stage evaluation, a few case studies of how we support clinician entrepreneurs, and tell you how you're able to get involved. So particular thanks for our website goes to Yazan, our communications lead, who has spent a lot of time and effort updating it. So this is our website. You go to www.ibra-net.com and you'll be able to read about us. You're able to read about the projects that you've already listened to. But I'm going to focus here on the Innovations tab. So on the Innovations tab, we've got Support for Innovators, a place where you can submit your innovations and a place you can get in touch. So if we look at the Support for Innovators, here we've got innovation links, which are useful, but we also point to grant opportunities that are different to the standard research grants and enable innovators access to a whole host of different grant opportunities to help fund their innovations. We've got a place that you can submit your innovations, and we'd encourage both clinician innovators and industry to register their innovations on our website, and then we will list them, and I'll show you how we list them. And we're building up an innovation-based database, and we hope to be the largest innovation-based database for breast surgery, so that any breast surgeon that wants to see what's new out there can come and see it on this site. And what we do is we divide that into 5 different sections. So we've divided into breast conservation, breast reconstructive innovations, the axilla, digital health, and allied surgical technologies. So I'll run you through these quickly. So if you click on one of these sections, for example, breast conservation, it shows that we subdivide this into localization techniques, minimally invasive or ablation techniques, intraoperative margin assessment, volumetric analysis, and ductoscopy and microrobotics. So if we look at a few, if we look at localization techniques, here you can see industry have submitted their Innovations, and it's important to say that none of these industry submitted innovations supplies endorsement by iBra-Net, but it is a safe place where you can list the innovations and where breast surgeons can come and see what is out there. And here we've got the localizer, we've got the MagSeed, we've got the Savvy Scout and the Serious Pintuition system, and a surgical navigation system from Canada. Similarly, if we look at the minimally invasive lesion ablation, we've got the Novolase laser ablative techniques, and there are other ablative techniques that we hope to add in due course. Intraoperative margin assessment, there's a whole plethora of these emerging as we aim to decrease our positive margin rates. And here we've got the ClearSight surgical MRI system, the mass spec pen, and the Mozart tomosynthesis system. And there are many more that we hope to add here in due course. Volumetric analysis is 3D breast assessment. Can be helpful both from a breast conservation and a breast reconstructive point of view. And then we've got ductoscopy and microrobotics. If you look at the breast reconstructive innovations, we've got information about material sciences, so ADMs, meshes, implants. You'll be able to find a whole host of information here. If we look at the axilla, we have things about node identification with MagTrace as an example here. Digital health innovations is a growing section. You can look at the UK government's First 100 report, which lists the UK's top 100 digital companies, many of which are relevant in breast surgery. We've got Concentric, which full disclosure is my digital consent platform, and other useful breast platforms, and we'll be adding to this as well. And then finally, the allied surgical technologies really encompasses anything else that may be useful to a breast surgeon. So innovative light solutions, headlights, diathermy, pencils, smoke evacuation, glues, aroma sets, etc. So this website is really meant to be the first port of call to find out what's happening. If there's any device on here that you're using that isn't on here, we'd love you to submit them or get the industry to submit them. And we'd love to work with you to help to evaluate these properly, firstly, maybe initially in a more local setting and then nationally. So here's a quick case study of how we've worked with Serious Pintuition detector. We worked with them pre-CE mark. We then had done their first in the UK feasibility safety, and now they're progressing into a iBra-Net national study. We've also worked with Clinician Innovators, and we offer this safe place to discuss ideas and seek advice. We can point to grants as listed on the right. A couple of examples are people who've come to us wanting to talk about 3D printing of implants or making a training application. So the future directions are we want to be the global resource for breast innovation. We want to work with innovators and industry throughout innovation cycle from conception through to evaluation. We want to allow access to different grants and to funders, and we want innovation to be seen as important from a subspecialty point of view. So this is a collaborative thing. We need you, so we'd love you to get involved. Do log on to our website, get in touch with us, submit innovations. We'd love to work with you to both design innovations and evaluate them. Thank you very much.